Infraorbital nerve is one of the branches or terminal branches of the maxillary nerve. It exits from the infraorbital foramen and supplies the soft tissue over the face. It has three branches: inferior palpebral, lateral nasal, and superior labial. So the indications of infraorbital nerve block is whenever any multiple teeth procedures are needed, from premolar area till the central incisor area of the ipsilateral side. This block is indicated. So the contraindications would be if there is any active infection in the site, or if only single teeth needs treatment to be done. The landmarks for infraorbital nerve block is the infraorbital rim. When you palpate here, you get a small notch. You get down, you get a depression, that's the infraorbital depression area, that's the infraorbital foramen. The approach is basically from the premolar area. It's known as bicuspid technique. From the vestibule that starts around the premolar roots, and the needle is directed parallel to the long axis of the teeth. The needle is directed in such a way that the bevel of the needle is facing towards the bone. This stopper has been set for around 15 millimeters. So when the needle slides onto the bone, it around 15 millimeter, once it is into the tissues, you will be able to feel it into the from the skin area when you are depositing. The final position will be in the infraorbital foramen area. If the bevel is reverse way, then it cuts the periosteum and it is more painful to the patient. Once the desired depth is achieved, the aspiration is done to check if the needle tip is not into the blood vessel, and then slowly deposited 1.2 ml over 30 to 60 seconds. A continuous pressure is applied onto the skin later, which helps in diffusion of the fluid into the foramen and anesthetizing the anterior superior alveolar nerve. So once the block is given, the three branches, the soft tissue branches, gets anesthetized: the lateral nasal, inferior palpebral, and superior labial. So the patient complains of numbness in this area where the nerve supply you are getting. The anterior superior and middle superior, they are supplying the mucoperiosteum from central incisor till the premolar area. Also the pulp chamber of the teeth. Infraorbital nerve block is the infraorbital rim. Then we get a small notch here. If you just move the finger down the notch, you get the depression. That's depression is the infraorbital foramen. Okay. You just see when you compress the foramen area, patient has soreness and pain in that area. So that stays one landmark. Then intraorally you see the premolar areas. The infraorbital foramen can be approached from the central incisor approach and the premolar approach, or the bicuspid approach. The approximate distance from infraorbital foramen to the vestibule is around 15 to 16 millimeters. Then with the bevel facing towards the bone, you, in the depth of the vestibule, you just approach, and once it comes, you get the bony contact. You can feel now the infraorbital area. Then at a very slow speed you deposit around 0.9 to 1.2 ml. Sure. Then you apply gentle pressure on the infraorbital foramen area so that the fluid diffuses into the foramen and anesthetizes the anterior superior alveolar nerve.